online.
Good afternoon and welcome to today's webinar titled Identity and Access Management for Healthcare, presented by Healthcare Innovation. My name is David Raths and I'm the Senior Editor for Healthcare Innovation. Today's program is sponsored by Imprivata, and thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, there's a few housekeeping details. To submit a question, please use the Q&A box to the left of your video window at any time. You don't have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Also, there's a white paper available for download in the event resources box, and it will be emailed in the thank you email you get for attending. Also, please join the webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, I'd like to introduce our speakers for today's program. We have Barbara Dumery, who is Senior Vice President for Product Management at Imprivata, and Wes Wright, Imprivata's Chief Technology Officer. They're going to give a presentation, and then I'm going to engage them in a little Q&A. And, of course, we'd like the audience to pose questions as well. And with that, I'll turn it over to you, Wes.
Hey, good afternoon or good morning, if you happen to be on the West Coast like I am, to folks out there. Thanks for that, David. While you gave a little bit of an introduction of who I am and who Barbara is, I'd really like to take the opportunity for Barbara to give a little more in-depth information about what she does at Imprivata and her background. So, Barbara, take it away.
Great. Thanks, Wes. And good morning and good afternoon, everyone. So my name is Barbara Dumery. I'm Senior Vice President of Product Management here at Imprivata. And what I'm responsible for is all of our products within our portfolio and thinking through the strategy and direction. I work with customers to help understand the challenges that they face and how we can provide solutions that help address those challenges and really deliver value. I've been in healthcare for over 20 years. I worked at a number of different companies, always on the vendor side, whether it was medical devices or PACS radiology software or speech recognition software for healthcare. And I'm thrilled to be talking with you all today. And back to you, Wes.
Thanks, Barbara. And a little more introduction on myself. As David said, my name's Wes Wright. I'm the Chief Technology Officer at Imprivata. I've been in this role for almost a year and a half now. Prior to that, I was on the provider side of healthcare for about 25 years total, some amount of time in the Air Force, and then over at Scripps and Seattle Children's and Sutter Health. Come to think of it, this is my first time having a job that doesn't start with an S. That just hit me right now. When I was approached to come to Imprivata, one of the reasons Gus wanted me to come in and join the team was to bring a little bit more, because I always thought Imprivata has probably a better feel for healthcare customers than any other vendor I dealt with when I was on the provider side. I still believe that to this day. But Gus brought me over to bring just a little bit more of the operational IT focus to what we're doing at Imprivata. So that's kind of my charge. And Barbara and I work closely together as I give the customer input and she designs our products. So before coming to Imprivata, as I said, I was at Sutter Health, and I did a pretty decent digital transformation product out there with Microsoft, using Microsoft and Citrix and Imprivata, of course, and a Follow Me print solution called LRS. And when I was talking with the Microsoft folks, they started using this phrase that you see at the top of the slide: identity is the new perimeter. And for the longest time, I could not figure out what they meant. Well, I kind of had a guess at what they meant, but now it's kind of sunken into me. And what to me that means is, back in the day, as short as 7 to 10 years ago, we had a pretty tight handle on what came into and out of our networks. and that was our perimeter. But now, with the proliferation of all these SaaS apps like Office 365, Workday, ServiceNow, UltiPro, Box, so on and so forth, we have all these applications that reside outside of our perimeter, and then we have all these other devices, the mobile devices, the medical devices, virtualized devices, VPN, so on and so forth, that further make that perimeter that much porous. So really, the only way that you can assure that the right applications and the right data are being accessed by the right people is to really control that identity. So that's where I think that identity is the new perimeter came from. I'd be happy to see what other folks thought about this, maybe at the end of the questions or something like that. So if somebody else had a different thought on what that really means, I'd be glad to hear about that, because again, I'm just kind of forming this in my head right now. So if that's the case, if identity is the new perimeter, what do we need to do? Well, prior to Sutter, I was at Seattle Children's for about 7 years, and Seattle Children's has been on their lean journey for, probably 25 years now. And one of the things that struck me and that they taught me when I was there as first CTO and then a CIO is to begin with the end in mind. So if I begin with the end in mind with identity and access management, what am I really trying to accomplish? Well, I said it previously in the identity is the new perimeter slide, but really what I really want to do is protect the applications and data. That's it. That's what we're charged with, whether identity is the new perimeter or the old perimeter is the new perimeter. That's what we're charged with, and that's why we need identity and access management, is to protect the applications and data. Now, from a career perspective, you also need to prove that you are protecting the application and the data. And like I said before, you have to make sure that the right identities have access and that those identities were authorized, and this is important, and reauthorized periodically to have access to that data and those applications. And then on top of that, you need to make sure that those identities didn't access data that they weren't authorized for. And the nuance of the new HIPAA HITECH Act says, okay, they have access to the data and the applications, but within those applications, let's say an EHR, for instance, you need to make sure that those identities only have access to the data that is necessary to perform their jobs. And finally, and I've gotten caught on this a couple of times in periodic access reviews and KPMG audits, you have to make sure that when an identity leaves an organization, access to the applications and data is removed as soon as possible, just as soon as possible. And like I said, I've had that audit black mark on my report card for a couple of different locations. It's a lot harder to do than it seems like, but that's something that you have to do when you protect the applications and data. And within healthcare, we have, and I don't need to tell you all that are on the phone this, we have some unique IAM needs. Unlike other areas, we have our workers, and I'm using air quotes, and I don't know why because nobody can see them. Our workers are actually our most highly trained folks in our organizations, and that's the physicians. And every time we try and lever some kind of security or identity and access management task upon them, we add to what we see in the newspapers now, to this physician burnout. And that's something we have to be really cognizant of, one, once they're onboarded, and two, when a new physician comes on board to your facility and your enterprise, the worst start that you can have with them is that they can't start seeing patients immediately. And with a good identity and access management solution, you can make sure that the right physician can immediately access the data that they need in order to see patients. And then, of course, I don't need to tell you all, once again, there's all kinds of literature that you can read out there that the number one attacked enterprise out there or industry out there is healthcare. I think personally, because there's so much good data in healthcare, we have way more than just credit cards and Social Security numbers. We have all kinds of stuff. When I was at Seattle Children's, as I mentioned earlier, that was one of the things that frightened me the most was that, one of our patients, a child, a pediatric person, their identity could be stolen and used in fraudulent ways, when they were 2 years old, and they may never know that until they were 16 or 17, when they started applying for credit cards. So that's another reason why healthcare is getting attacked like nobody else's business. And also, one of the bigger challenges is how fluid our workforce is. With the mergers and acquisitions that we have going on right now in healthcare, by the way, happening at a pace that I've never seen in my 25-year career, the control and assignment of those digital identities becomes that much more important because of those mergers and acquisitions, especially when you have a fully implemented EHR system and start using virtualization in order to do these mergers and acquisitions. Again, that identity is the key to controlling who has access to what and should they have access to it. So really, all boiled down, it's those two things. Through role-based provisioning and deprovisioning, you are protecting the data and applications, which, remember, that's the end that we began with. Our number one thing is to protect the data and applications. And the way we can do that most effectively is through role-based provisioning and deprovisioning. But then from a career perspective, we need to prove that we have protected those data and applications. And the way we do that is through an identity and access management solution that has a robust governance, risk, and compliance module with it. And this is something I'm particularly proud about at Imprivata. As many of y'all know, almost all of y'all who are on the call would know, Imprivata is about healthcare. That's what we do. That's all we do. One of the reasons I came to Imprivata is it's the first company I had ever interacted with as a provider that actually, before they implemented or before they would let me implement one of their products, they came out with nursing staff to make sure they weren't getting in the way of my workflow. So that was really key to me, that Imprivata knows healthcare so well. And that's translated into our GRC product that's in our identity and access management solution called IDG. When you stand up our system, that periodic access review or the user attestation or the DEA EPCS, all those reports that are healthcare specific come out of the box with our GRC solution. We have teams of people that make sure that the reporting that we are generating out of our GRC is healthcare specific. So all boiled down, you have to have role-based provisioning and deprovisioning in place, and you absolutely have to have your governance, risk, and compliance in place so that you can prove that you did protect the data and the applications. So that's all I had on my agenda to talk about, David. I'll turn it back over to you now to start the questions and answers.
Great. Thanks, Wes. That was really interesting. I have a handful of questions to kind of get a discussion going, but before I do that, I want to remind the audience that they can submit questions at any time, and we'll include them in the conversation. One of the things that was on Wes's list of one of the PowerPoint slides was mentioning regulatory challenges, and so my first questions was: are there some unique regulatory and auditing requirements that require expertise to work through when applying them to identity and access management implementation in healthcare? Maybe Barbara can respond to that one.
Yeah, sure, absolutely, David. Yeah, it's really, especially what's important for us on the product side here, to make sure that we keep up to date and really understand those regulatory drivers that are unique in healthcare. And there's a number of those, and Wes certainly touched upon that. The biggest one, of course, is HIPAA and all of the, security controls that you need to be able to have in place, but also demonstrate that you have them in place. So there's a lot of reporting and auditing that's required around those HIPAA controls. And it's really about making sure that the security, of course, is intact. What we're seeing is that there's an increase in phishing attacks and certainly ransomware attacks and certainly more insider threats. And so that's what, Gus talked up there, what Wes talked about with the importance of, identity being the new perimeter. For a lot of organizations moving to zero trust security, that you need to be able to enforce that security with their identity. Some other regulations that apply is certainly the regulations around electronic prescribing of controlled substances. So the DEA, or the Drug Enforcement Agency, has a lot of regulations and requirements about being able to prove that the person who is ordering that prescription is actually the valid prescriber, and that there's a secure chain of trust all the way to the pharmacy where that drug is distributed. And there's a lot of different pieces of that DEA regulation, and certainly NIST standard comes into play on how a user can be able to be identified and have the right levels of assurance there. We're also starting to see some new regulations called TEFCA, and this is really about how patients and patient identity can be maintained as the increase of patient record interoperability comes into play. This is really sort of like the meaningful use 3 with the promoting interoperability of being able to really be assured that you're looking at the right patient with the right medical record, and that you're able to show that you have the right identity controls. So those are some of the main ones, and I don't know, Wes, if there's anything that you want to add to that.
No, you hit the major ones, and the one from a purely selfish and operational perspective, the ones that gave me the most trouble were that periodic access review, or the user attestation is what we call it within our product. I think that's something fairly unique to healthcare. I don't know. As I said, I've been just doing healthcare for the last 25 years, so it's something that I'm used to. But it is always something to get down to that level of, okay, this person has access to this part of the record, and within that part of the record, they only have access to this part of it because that's all they need to do their job. So getting a reporting engine that will ask that question to the right person has always been a challenge for me from an operational perspective. And I think that's fairly unique to healthcare. And I'm, of course, HIPAA and HITECH make that a regulatory requirement. But then a bunch of the audits that I had come through, KPMG, Deloitte, PwC, and all those, I also wanted to see that we could do that on the ERP side of the house, the accounts payable, and so on and so forth. I think maybe, and again, not unique to healthcare, but I think maybe that was a Sarbanes-Oxley driven regulation requirement. So not only do we suffer under the healthcare specific regulations, but we also get the finance Sarbanes-Oxley regulations piled on top of us as well.
Well, Wes, you mentioned ERP there for a sec, and we actually have a question from the audience. I'm going to interject here because I think it's a good one. The question is, rapid automated provisioning and deprovisioning requires integration with your ERP or HR software. And how do you do this?
Yep. Yeah. I 100% agree, and Barbara, you can pile on after I'm done with this. But yeah, it requires integration at 2 points, really. What the questionnaire mentioned, at both the provisioning point and the deprovisioning point. And at the provisioning point, what we do with our product is we bring in the demographic data. So generally your ERP system, your new hires are done by your HR folks, and they will input the demographic data into an ERP system. It's called a Lawson or a Workday or something like that. And from there, we have either API or other integrations that when that data is entered into that ERP system, we suck it into, not the most glamorous word, we transport it into our identity governance system, and based upon the variables that the users of that system determine, the account is provisioned. If it's here's their job code, they work at this place, and they work these hours, and so on and so forth, we have a role. Again, role-based access is really important here. We have a role developed that meets all of those criteria, and that is automatically provisioned using the data from the ERP system. But the beauty of our product, too, is we can take multiple feeds. It doesn't have to be just a Lawson system. It could be a Lawson system plus a MSOW credentialing system that comes together within our IDG system. So that gets the role-based access done for that unique digital ID. And then on the other side, the way we interact, again, this is an HR interaction, is when a person leaves an organization, there's generally a termination report that's generated at least once a day. And again, that termination report is ingested into our identity governance system, and we say, okay, here's the ID we provisioned a long time ago. That person's no longer with the organization, so now we will deprovision that system or that identification, that digital ID. And that works for about 80% of your applications. So any application that is what we call Active Directory aware, so that when you deprovision that Active Directory digital ID, they're deprovisioned from about 80% of the records. But in healthcare, as many people know, we have a bunch of applications that aren't Active Directory aware. And we use our identity governance product to manage those applications as well, so that when we get the termination report from HR and it says, hey, terminate or deprovision this person in Active Directory, bam, we deprovisioned it in Active Directory, and then there's a report that pops up. It's called an orphan accounts report that says, oh, hey, by the way, you deprovisioned these folks in Active Directory, but did you know they also had these accounts in the cardiovascular system, the radiology system, the oncology system that aren't Active Directory aware, so you may want to go out and deprovision those as well if you haven't already set that up for automatic deprovisioning in our system. So yeah, the interaction between HR on both ends of the identity and access management solution from a provisioning and a deprovisioning perspective is critical.
Barbara, did you want to add anything to that on the integration front?
Yeah, I mean, Wes did a great job. I think the only other thing that I would add is what's important in that is, especially in the roles, is that those attributes that can come from the HR system also get carried over into that provisioning and deprovisioning process. And that's especially helpful when you're needing to provision a user in their electronic medical record. We're able to provision them at a very detailed level, so you don't have to create a shell account and then go back in and have to, provision at that deeper level. They can have that day one access. We're able to leverage those attributes coming over from the ERP and HR system.
Yeah, and Barbara, that's a great point that I mean, that's because we know healthcare. That's because we do healthcare, and that's because we're so deeply integrated into the major EHRs out there. I mean, we can provision in Epic to the SER and EMP level, down to the template level, so that, again, like Barbara said, you don't have to create the shell accounts and then have somebody else come back in and put the right attributes in there.
Mm-hmm. Okay, well, let me move on to the next question. So Imprivata is combining automated identity management, enterprise single sign-on, and authentication management, and the products are OneSign, Confirm ID, and Identity Governance. Can you describe a little bit about how all those work together?
Yeah, I'm happy to take this one. So it's really a single identity access management sort of solution suite. And what we like to think of is to be able to really achieve that high trust digital identity in healthcare, you need to have those three major components. First and foremost, obviously, you need to have the governance around your identities, especially the provisioning and deprovisioning side. Second is you need to be able to have assurance of that identity. So that's where the multi-factor authentication comes in with Confirm ID. And then third is you want to give that productivity and, access to the clinicians. Really, ultimately, that's all what they're trying to do is get access to, the medical records, to the different systems that they need to be able to focus on patient care. And what we're able to do with all of those solutions together is a number of different things. One is, first and foremost, when a user, comes on board and they're ready to be provisioned, we're able to have them be automatically provisioned in the single sign-on system. And all of the, the password credentials are able to be populated. So that does a number of things. One is that you can use very complex passwords, and that's great for the IT department. And second is that, again, from that day one use, the user can go ahead and use their badge to tap into Workstation to access the information that they need, and they're already able to single sign on to everything. So it's a really quick and easy way for them to have that day one access. The other piece that's really critical, and Wes, touched upon this as well, is that you can now compare what a user has been accessing versus what they have been provisioned for. So there's a number of different things that kind of a report can give you. One is if a user has been accessing a particular system but they haven't been officially provisioned for it, then what can happen when they leave the organization is that they're then not going to get deprovisioned. So obviously you then want to make sure that they get officially provisioned so that they can then get properly deprovisioned later. Or you could also say, hey, that user isn't actually supposed to get access to that particular application. Nowhere in their role does it require that kind of access, and so then you can shut off that access. So it's a really great way to be able to compare and contrast between these different systems. Wes, is there anything that you want to add to that?
Yeah, there was, and that was a great explanation, Barbara. From a practical perspective, this really kind of helps from a security perspective and that physician burnout perspective. Barbara mentioned it at the beginning that, okay, if you have with our identity governance system coupled with the one single sign-on access management single sign-on system, what you can do for any applications that a role is supposed to have, let's say a physician role is supposed to have access to the EHR, they need their ERP system, and they're a cardiovascular physician, so they need access to this non-Active Directory aware cardiovascular system and this other non-Active Directory aware transplant system or something like that. So using our identity governance product, you can assign passwords to those systems for that provider so that when the provider taps their badge in for the very first time, all they'll have to do is register their badge, which they use one single password, which is usually their Active Directory credentials. And then behind the scenes, we can single sign on that provider into all those other non-Active Directory aware applications, and of course all the Active Directory aware applications. So that provider, when she or he comes on staff, doesn't know that actually in order to access all the applications she or he needs, there's really a requirement of about 6 or 7 different passwords because they're not LDAP aware and so on and so forth. So you mask that contribution to physician burnout by using these two products together. So you've alleviated the physician burnout, and then because the provider doesn't know his password, you've eliminated the possibility that she or he is going to write that password down somewhere because they keep forgetting it. So the combination of those two systems, I think, really make for a good lever to use against both physician burnout and cybersecurity.
Okay, great. Well, from your health system CIO and CISO customers, are you hearing things about the benefits of having a single integrated suite of identity and access management tools?
Yeah, I'll get this one since I was just talking about it. We actually, that is one of the bigger benefits from the CISO perspective with all of our tools put together. And we had Confirm ID for remote access and Confirm ID for EPCS. So those both use a token service, and they're both integrated into the Imprivata suite of identity and access management tools. And so when a provider comes on board, first, and this is the CIO's perspective, first, I'm alleviating that burden of the physician burnout. I don't have to send her or him 4 different emails saying your password for this system, your username for this system is this, and your password is this, and so on and so forth. No, instead, here's your badge, and here's your password for your Active Directory account, and we will mask all the other password and all the other application access issues that you have behind that. That's great from the CIO perspective. And then from the CISO perspective, if you think about this, what you've done is made nearly passwordless access to all the applications on your network. And again, what that does, because CISOs, they really do, believe me or not, CISOs hate passwords because passwords get compromised. So if you have made nearly passwordless access to all your applications, and you do that with a single badge tap during the day, you put in that second factor one time, and then everything else a single sign-on using OneSign. When you've done that, you've alleviated some of that password angst and worry that the CISO has. And then with those managed applications that are in identity governance, most of the time, you can make those passwords as complicated and as long as you want. So they're really nearly unbreakable. So those are the 2 CIO, CISO perspectives. Barbara, you got anything to add to that?
No, I think it's great.
Okay.
Yeah, let me move to the next one. Again, from talking to customers, do you think they're starting to see identity and access management as a discipline they need to have a strategy around and a team to address on an ongoing basis rather than just a one-off project that they do and then they're done with?
Yeah, I'm happy to take this one, and certainly Wes, you can chime in. Absolutely. I mean, I think we've already seen this shift happening in healthcare over the last probably 5 years or so, where the discussion about the importance of security has really been elevated, so much so now that it's commonly a regular topic with the board of directors. And so that's a number of different things that manifests itself with, certainly having the discussions about the level of investment that's required to maintain security in an organization. And also what we're seeing is more and more CISOs, being part of an organization and being hired in. Often they're coming in from, potentially different industries, which is great to get that expertise in. And then, what we see is them ramping up on those unique workflows and those unique challenges that exist in healthcare. But yes, absolutely, and I see that as sort of an ongoing effort.
Yeah, and I'd agree with Barbara. We are starting to see that, but actually we're kind of starting to teach it a little bit as well. For the longest time, we in the CIO, CTO, CISO kind of area, we looked at these as distinct things. Like provisioning and deprovisioning was done by this team, and access management and single sign-on was done by this team, and something else was done by this team. And now we are starting to see the CIOs and the CISOs go, wait a minute, this is all about digital identity. So I need to control that digital identity from bad for healthcare, from cradle to grave or from soup to nuts. I need to be able to see what is happening with that digital ID when I provision them, and then when I give them single sign-on and multi-factor authentication, when I give them EPCS capability, I need to see all those digital identity events together in a seamless solution type of frame, and not as separate products. And we are starting to see things bend that way right now, and that the CISOs and CIOs are starting to kind of catch on to that.
Okay, great. Barbara, you mentioned developing a solution to help providers with electronic prescribing of controlled substance. Could you talk a little bit more about what was involved in developing a streamlined solution there? Any recommendations when you're working on that particular use case?
Yeah, I mean, I think there's a number of questions maybe in that. So we had developed this solution a number of years ago, and it really started off with first the Ohio Board of Pharmacy in Ohio having more stringent regulations about, being able to demonstrate and have the audit records around re-authenticating a number of different workflows like witness signing and administration. And then it was the state of New York with their iStop regulation that really started to elevate the importance of being able to have the right controls around the electronic prescribing of controlled substances. And what we see now with the federal mandate looming, and certainly with Walmart as well, saying that all of their prescriptions will, for controlled substances, will only be received as electronic. It's a huge push for organizations to move, and so we've seen just a very high adoption. And what our solution is able to do, again, it's just that, beginning from the point of, really being able to identity proof a physician, making sure that they get enrolled in the right way and that there's the right supervision around that particular step, that there are the right controls when they're actually doing that authentication, that we try to streamline that as much as possible for the physician. So we're the only vendor with the hands-free authentication capability, all the way then to that secure chain of trust at the point that it goes to the pharmacy and we have all the audit records around that.
Okay, great. Well, we have a couple questions from the audience. One is, and we've talked about this a little bit, about the evolution of thinking in healthcare IT, but are there some common misunderstandings still that IT leaders might have about IAM in healthcare?
Barbara? I have a couple off the top of my head. Yeah, I think that misunderstanding is what I just talked about earlier. Is that the IAM events were, and again this is changing, but they were seen as separate solution sets, oftentimes managed by separate organizations within the IaaS enterprise, so that user access or the user provisioning and deprovisioning was managed out of the CISO shop, whereas the access management and single sign-on was managed out of a regular IT shop, usually championed by the chief medical information officer, who realizes the efficiency that can be gained through a good access management single sign-on solution. And then, of course, EPCS would be also championed by a CMIO, whereas the Confirm ID, same product essentially, Confirm ID for multi-factor access, might be managed out of the CISO shop, or somebody from the network shop who does VLANs would be managing it. So I think that's the hurdle we're trying to get over in the identity and access management space. And the paper that you wrote around this, David, it really helps a lot with this and explaining how the pieces and parts fit together. That's the major misconception that we're seeing out in the marketplace.
Okay.
Yeah, I think
go ahead, Barbara.
Yeah, just one other thing to add to that, and I think this is related to that trend that we were talking about with CISOs coming in from often, maybe outside verticals like finance or even military in some cases. That one of the big things that I hear from them that is new that they've learned is just about the shared workstations and really the frequency with which users are walking up to workstations and walking away. And, you'll have a particular workstation you may have 100 different times throughout a day that a user is walking up to that, interacting with that endpoint, and then walking away. And what that really does from an identity access management standpoint, and the challenge that brings, being able to, access both your on-prem assets and your cloud assets, being able to transition your identity easily, across all those different types of applications and really have that federated access. And so that's an area that we really see it's increasing in complexity because of the addition of cloud applications with that. But it's always been this idea of the shared workstation and how challenging that is for a lot of other vendors to manage.
Okay. I had one more discussion question. Do you have advice or suggestions, or have you helped healthcare CIOs make a return on investment argument to a board of directors for investing in IAM solutions? Is it efficiency gains or cybersecurity improvements or both?
Yeah, sure. So the main one, primary one that we focus on is really the productivity improvement for the clinician. And that comes in a number of different flavors. Certainly, first and foremost, is making sure that day one access is so critical. We hear from some customers that they have surgeons that are coming in from outside organizations that are not able to perform their surgeries. You can imagine the dollars being spent in the operating room because they don't have access to everything that they need on day one. So that's, of course, a huge impact. And then it's that day-to-day impact of the clinician, putting in their username and password and all of the difficult ways that they might need to re-authenticate and streamlining that. It does a number of things. One is that it really increases the mental burden and load on that clinician. They just really want to focus on patient care. It leaves more opportunity for that end user to make an error when they type in a really long password. It introduces a lot of complexity there. So it's a huge time saver for clinicians. And we've done a number of different sort of case studies as well to go back after the fact and look at the productivity improvements and what that really translates into an ROI. And certainly happy to share those kind of case studies if folks are interested.
Okay, great.
Yeah, and just to add on to that, David, it's the CISO going to the board that says, I need to know, again, back to the security or identity is the new perimeter. I need a tool that I can tell you without a doubt that these identities have been authorized access to these applications and these data and this data, and that access is periodically reviewed and reauthorized by somebody else. It's almost becoming hygiene and less ROI based from an identity management perspective.
Okay. Hey, we have a few more questions from the audience.
Okay.
The first one is, can you generate a report of deprovisioned credentials, e.g. employee leaves, that someone is attempting to use for access after the employee has left?
Do you want to take that one again?
I'd just be guessing, Barbara. If you have the answer is I think we can, but it's not. I don't think it's something that would come out of identity governance or identity governance product itself. It would come from some other reporting that you could be made aware of. If the question is what I think it is, and that is somebody's trying to use some credentials that we know have been deprovisioned, and they want to use them in a nefarious way and try to get back into the system.
I think the only other thing is certainly in our dashboard, we can take a look at users and what they're still accessing from the one-sign data with single sign-on. So it kind of depends on, maybe some variables that the customer, if they were, if those were profiled applications and they were using them with one sign, and then certainly being able to match that up with whether or not they've been provisioned or deprovisioned for those.
Yeah. And I imagine we could pull out of the Active Directory or whatever IDP system logs that they used that showed an unsuccessful login since that system has been deprovisioned.
Okay. Another question from the audience. Do you provide registration as a service and biometrics, making it easier for the patient as well? And if so, how?
Yes, absolutely. Yes, we have a solution called Patient Secure, which helps with the positive identification of a patient as they, get registered. And so what this solution really entails is that when a patient comes into an organization, they can place their palm on a palm vein scanner reader, a biometric reader, and then it can automatically pull up who this patient is, identify that patient, and making sure that they are then, correctly identified and associated with the right medical record. So great solution. We especially see this with organizations that have a lot of, issues with maybe duplicate and overlay records, and we find that most organizations, struggle with that to a certain degree. And being able to have that confidence that you're really able to identify the patient when they come into the organization. And again, with the Trusted Exchange Framework, the TAFCA regulation, this is going to be something that increases in importance of being able to show that you have a mechanism by which you know that you have that high trust that you're treating the right patient.
Great. Well, I think that's all the audience question we have right now. Do you guys have any concluding comments you'd like to wrap up with or stress as we go out?
No, and certainly if there's any questions that we didn't get to, we'd be happy to follow up with folks via email.
Okay. Well, I want to thank both of you. This has been a very informative webinar, and I'd like to thank Imprivata for sponsoring it and making today's program possible. And I want to thank everyone in the audience for joining us, and we hope you'll join us in the future for another healthcare innovation webinar. So that concludes today's presentation. Thank you.
Thanks, David.
Thanks.
Thank you.